All right, I hope you all enjoyed your break. Ready to get going again? Just a reminder, you can pick up your certificate of attendance at the registration kiosks at any point. So that certificate has the required CME program evaluation questions that will need to be filled out and turned into the registration kiosk. Again, that's only if you are seeking CME credit. Okay, I would like to invite Professor Jack Turman, Jr. to the stage. Dr. Turman is a professor in the Department of Social and Behavioral Sciences at the Richard M. Fairbanks School of Public Health, Indiana University, IUPUI. He is leading an initiative funded by Riley Children's Foundation to train and mentor grassroots maternal and child health leaders in Indiana zip codes at high risk for infant mortality. Dr. Turman.
Thank you. So good morning, everyone. How are you? Feeling full and stuff? That's awesome. Well, it is an honor to be here today, and I extend sincere thanks to the organizers of this for inviting me and my wonderful colleagues to come and address you today. It's an honor to be here, and it's an honor to share this stage with Indiana's first grassroots maternal and child health leaders. And it's a tradition of our meetings, we always start with gratitude. So on behalf of everyone associated with this effort, we want to extend our thanks to Riley Children's Foundation for all their support and funding of this initiative. We are at, let me see here. Sorry about that. We are at an important time in our history. Around the globe, women are speaking out, taking charge, changing destinies, and shaping a better future for all of us. And not just in the United States, but in places like Rwanda, India, Kenya, Tunisia, and Jordan, women are raising their voices and amplifying the voices of other women in their communities. These heroines not only work to serve individual needs, but also work to bring about systems change that brings about much needed gender equity. And now, my friends, we have these women in Indiana. And these women, our grassroots maternal and child health leaders, are raising their voices and taking action to reduce our infant mortality rates. Do you know that grassroots efforts led by women have been shown to bring about changes in social, environmental, economic, and political systems that we know determine the health outcomes of women and children? And these efforts are beautifully done in concert with our health and social service delivery systems. We started the Grassroots Maternal and Child Health Leadership Initiative to train community women to lead efforts to address the root causes of infant mortality in our most socially at-risk neighborhoods. The work that they perform inform us of the reality and the humanity of infant mortality. They teach us how it affects a woman, how it affects her family, her neighborhood, our society. They work to build the capacity of marginalized individuals, families, and neighborhoods to support healthy pregnancies in infants. They inform organizations about how to do their work through a lens of infant mortality reduction. And they are developing, advocating policies that ensure that every woman has a right to a healthy pregnancy and that every infant gets off to a great start. These women are the bridge builders we so desperately need to have the kind, thoughtful, fruitful, non-judgmental, bi-directional conversations between community members and healthcare providers and policymakers. It is out of these deep conversations that we will all come together and work together to address the societal issues that make us one of the worst states in the union for infant mortality. History reveals that it is the outcome of grassroots efforts that lead societies around the world to a healthier, more equitable state of being. Our initiative is grounded in this history, and we are working to perpetuate this truth in Indiana to reduce infant mortality. As our tagline states, if you want to improve infant mortality rates, ask the women. So I challenge you, put the phones down. Let's give the women a listen.
Hello, my name is LaToya Hale-Tahirou, and I have 3 beautiful children. I gotta say, when I was a little girl, I never dreamed of public speaking. Honestly, I'm really shy and I'm a little bit nervous, but when I look at my community and the data and the stats that's going on, that gives me all the courage that I need to speak up, stand up and speak out. So I've been a Grassroots maternal and child health, thank you. I've been a Grassroots maternal and child health leader for about 1.5 years now, and I am grateful and honored for this opportunity to speak here today at the 2019 Labor of Love Summit. Mothers and babies of color are dying at alarming rates. Data show African American mothers and infants are 2 to 3 times more likely to pass away from preventable causes than Caucasian mothers and babies. We must take a step back and closely examine why this is, and more importantly, how do we eliminate this heartbreaking fact? This is a social health epidemic that I will no longer allow to be ignored. A great man by the name of Eddie Woods stated that Indianapolis is resource-rich but systems-poor. I believe the same can be said about many other places in the United States as well. We must find out ways that we can collectively come together to achieve impactful, sustainable change. I personally believe systematic oppression and historic generational trauma are the roots of this social problem. Real change to heal these toxic roots can only happen at a political level, period. We need policies in place to, We need policies in place to improve birth outcomes, policies that promote healthy pregnancies and infants of families of color, policies that increase protective factors and reduce risk factors. We need policies that will equip mothers and communities with the resources they need to reduce and eventually eliminate maternal and infant mortality. Urgent, impactful policies are needed like yesterday. In my community, there's a history of trauma and undiagnosed mental illness that leads to self-medication with cigarettes, drugs, alcohol, and other toxic behaviors. The majority of people in my family lack education, economic security, and good health. My great-grandmother, Helen Jones, lost her mother around the age of 7 to mental illness. Her mom tried to put the baby in the oven. My grandmother, Betty Decker, lost her mother around the same age to a car accident. She was paralyzed and she was placed in a nursing home. My grandfather, Stanley Jones, grew up without parents until around the age of 17. I grew up most of my life without stable parents in my life as well. Now that I'm a Grassroots maternal and child health leader, I now know when a child grows up without a healthy maternal bond, it has a life-altering consequences. One of the greatest reasons I'm committed to this work is because I have a cousin who lost her 4-month-old son due to suffocations during unsafe sleeping conditions. I am committed to creating a narrative of hope, healthy pregnancies, and thriving babies for our next generation. Studies show that one of the most effective ways of promoting change is peer-to-peer work efforts. There's a quote I recently saw at a conference I was at that said, "It takes the hood to change the hood." Genuine relationships and skill buildings are the key if we are to change this horrible narrative of infant mortality. To help create a new hope-filled generation, as a grassroots maternal and child health leader, we host community baby showers in our affordable housing community. These showers are skill-building sessions for all women and provide a place where they can know and support each other. We surveyed our community to learn what they wanted to learn and are providing sessions to address their priorities, which so far is postpartum depression. We are using storytelling as a tool to tell our stories to promote change in our communities and at a political level. Keeping stories of infant loss and family trauma a secret is not healthy for our communities. We are aiming for national change through a documentary being made about our efforts by Professor Kyle Miner at IUPUI. Going forward, as a grassroots maternal and child health leader, we plan to continue to learn and facilitate workshops to build skill sets in others so that they can build healthy communities, push for policy change and development, teach families how to build support systems for moms, promote healthy family relationships by changing mindsets and guiding families to healthy resources. Generational change is tough, but together we can do it. I encourage everyone here to take one action to help communities overcome generations of trauma and oppression. It is our responsibility to prevent the next generation from suffering from infant mortality. Thank you.
Hello, I'm Kelly Evans, a grassroots maternal and child health leader, life coach, mother, community advocate, and servant. Thank you for the opportunity to share with you my experiences and to take you on a journey to empower communities, create social change, improve policies, leverage the self-efficacy of mothers, aunts, grandmothers, cousins, the family leaders who improve birth outcomes. Healthy, educated, and compassionate people are community's most valuable asset. They are the strength and the muscle that move the community towards change. The community's level of support and connectedness determine the health outcomes that create generational change. I invite you to examine with me how we can create more effective policies to reach more people to create environmental changes that have the power to change economic and social outcomes for a new generation. The work begins with us. How we reach people and how we build the skills of the people we empower. Over the past 15 years, I've worked with women and children. It was at the very beginning of my career that I learned the importance of educating and building authentic relationships that could change the lives of the children in the community. It was during this time as a home visitor on the front lines working to prevent child abuse and educate families on child development that I saw firsthand how training the leaders in the family and the community to value children could reach more people than I ever could alone. During this time as a family support specialist, I worked with a mother and daughter. They both had newborn babies at the time. The daughter wasn't comfortable at first with having her visits at home by herself, so she had them in conjunction with her mother. Over time, she became comfortable with me as she learned what I was there to do. We began to have our visits at her apartment then. Every time I arrived at her apartment, there were an assortment of people just sitting around, hanging out. It was during that time that I would show her how to interact with her child, positive ways. I would do different activities and give information. It was to my surprise that everyone else in the home was also listening. Over several weeks, the number of people in the home grew. I was teaching the mother activities, I was doing things around child development, and the visitors began to ask questions. They began to share during our visits as well. On one visit, a man shared with me that he had gone home and shared with his girlfriend the information on safe sleep. And together, they decided to take the toys out of the baby's crib. Each week I returned, they shared stories with me about how they used the swaddling techniques and how they worked with their babies on grasping. I shared, and they shared how they told their friends and their families about safe sleep, about how nutrition was critical for infant brain development. Soon, my home visits became community visits. I handed out information about hygiene and safe sex. It was then that I became affectionately known as the condom lady. It was a safe environment where a mother's community could gather to learn, ask questions, and share information. They took the information back that they learned and dispersed it to the wider community. It is because of this experience that I learned it is the people in the community that are the most effective at disseminating the information, and they have the power to make the connections, and they are the catalyst for change. I was acutely aware that it was my role to emotionally support and non-judgmentally connect with the people that I served. The information that they took to their social circles was critical. I learned that no single agency could have the capacity to reach people on a personal, authentic level the way the family and the community leaders have the ability to do. Investing and building the community and family leaders will increase the chances that critical information will reach those that need it most. These leaders set the standard for how infants are cared for their families and their communities. They have the power to make that generational change. As a grassroots, maternal, and health child leader, I coach and strengthen the leaders in the community to encourage them to share their stories, to build their confidence, to effectively work in the community to improve birth outcomes. I'm calling on you to invest in grassroots leaders. Allow grassroots leaders to have a seat at the table where the decisions to reduce infant mortality are made. Investing in these leaders will increase economic growth, improve birth outcomes, and build the capacity of the community to support all women, babies, and families in their neighborhoods. Thank you.
Good morning. Good morning, and my name is Tia Washburn, and I'm a grassroots maternal and child healthy leader. Okay. Who is very passionate about change in our social system into mechanisms that support and not judge pregnant women suffering from substance abuse disorder. Thank you so much for allowing me the opportunity to share my experience, my strengths, and my hopes with you all this morning. I am here to talk about building healthy communities that will connect, support, and share and save women who are struggling with wanting to be a good mother and at the same time being on a journey of escape from the horrors, realities which led them to substance abuse. I have a couple questions to ask you all. What were you all doing at 8 years old? Well, were you escaping trauma, abuse by shooting up heroin? I want y'all to think about that. Well, right now, down the street by the large Indianapolis Public Library, there are children just doing just that. Right now, in your own life, what are you doing to escape your daily stressors? The fact is that we all do something. Some of our fellow residents are coping by using substance abuse that are killing themselves and their babies. Perhaps not killing physically, but killing any possibility of healthy communities that might make to be a contribute to our community. While many of us have opportunities that can build communities of hope and a promise of freedom, there are many mothers, fathers, and children that are only here their connection is to build fear and despair. Why am I so passionate about this issue? Why do I want to use my platform as a grassroots maternal and child health leader? Because I want to break the grip of addiction for pregnant women. I want to use to be in the grip. I was the one that used to be in the grip, and here's my story. Ooh, I'm nervous. Oh, wait a minute. I was blessed to grow in a Christian home. My father and mother had been married over 54 years. My life changed if I got married. In the beginning, life was great, and our children were born. Life started getting tough as the verbal and physical abuse progressed. Reality hit me. I was no longer under the safe haven which my father and my mother had built for us. Not wanting to reach out to them or anyone, instead I reached out to substance abuse. It introduced me to a new way of escape. I never thought or even imagined I would use drugs with my unborn children. By the grace of God, they weren't addicted. I was given the opportunity to escape a new way of life and escape from the horrors of addiction. I had individuals that were supportive of me. But what about the mothers and the children who don't have the support that I have? You may think that you are exempt from circumstances like my own, those living down the street. But in reality, no one is exempt. For sure, I can tell you that our local communities struggle of the horrors of addiction on a daily basis. Not just the drugs-infested areas, but as I shared earlier, right down the street of our own public library. I talk to women trying to find a way out. It's not all about the opioids, which we only have funding for. We still have mothers and children addicted to crack, meth, K2, and other substances that are in our neighborhoods. This too is an epidemic. Why do I say that our communities are struggling? Because right now, in someone's labor and delivery room in our city, a mother high on drugs is delivering a baby high on drugs. Think about this, my brothers and my sisters. The precious mothers and babies are our foundation of our society. This is a struggle, and we are too. We as a people have a more responsibility to give hope, guidance, and non-judgmental support to each mother and baby. Infant mortality has a horrible grip on our society. As a grassroots maternal child health leader, I am committed of being a service to these mothers and babies that are in the grip of the substance abuse disorders. Here is what I'm trying to do. I am focused on creating an advocate for policy that gives these women and children the support, guidance, and help to overcome these problems. The first step, increasing, is housing opportunities for those mothers together with their children. We need homes for these mothers and their babies. We need homes that support and build life skills for these individuals. The homes need to be safe and secure and filled with individuals that offer community connections for a chance at a better life. I'm just not committed, but dedicated. Being involved with these social issues, our team leaders have formed a coalition to create more housing opportunities and ongoing support for these mothers and children. I hope I have given you a vision, the value that I see in these mothers and children every day. Each of these mothers and children have a potential to keep our societies. Let's prevent them from dying physically and mentally and physically and allow them to live and thrive in their lives. Thank you.
Hi, my name is Kim Walker, and it's not only a privilege, but it's an honor to share with you all today. I really like this year's theme of the summit, which is Connecting Communities, because this affords me to talk about where I live and what my community is doing to help women have better access to services while they're pregnant and after they deliver their child. So let's talk about my community, which is Mapleton Fall Creek. It is important for you all to know that it's not just health clinics that are promoting or asking for healthy pregnancies and, I done messed up, promoting healthy pregnancies and babies. Sometimes the help comes from the most unusual places, like the Children's Museum that's located in my community on 30th and Illinois. Inside this museum is a library called the InfoZone. This is truly a place that serves as a bridge to making my community healthier. This is truly, I messed up again. The InfoZone has a service plan that provides books and computers on site for families to learn about healthy infants. They also are connected to another entity called the Diaper Bank. The Diaper Bank is a nonprofit organization. It was established in 2017 that provides basic baby diapering essentials. Its purpose is to assist low-income families so they don't have to make the choice between, should I feed my family or diaper my child? Believe me, the struggle with this decision is real. Helping a mother obtain her basic baby essentials improves the mother's mindset, which will reduce stress and bring about a positive change. So the mother can also better nurture her child so she can learn and grow. Oh, goodness. For me, connecting communities means all sorts of people and organizations providing care that promotes healthy pregnancies and babies for all. Now I'm about to cry. I was not afforded that opportunity of being connected. I was disconnected with my community because I am that woman that smoked crack cocaine with her child. I was too busy hiding from my community because I was ashamed. I was not surrounded by any healthy habits or prenatal care. I rarely made any doctor's appointments, and I did not maintain any type of healthy weight. I had the precious gift of life inside of me, but I couldn't stop smoking crack. The baby growing inside of me had no say-so in living out the horror of my addiction. First of all, I wanted to let y'all know that even though I was rejected by the world, I was chosen by God. I wanted to let you know that the baby birthed out of my addiction and my pain is a miracle, and her name is Rashonda. And she was born with a godly purpose. My story is shared from my pain, so my prayer is that my pain touches your heart. Not a pain that hurts you, but a pain that motivates you to form connections with hurting pregnant women around you. We are all bridges to our own communities. Could you be the person to stand in the gap in your community so that vulnerable, hurting pregnant women can get to the other side of the bridge? Could our local churches be a bridge to hope instead of shame? As a grassroots maternal and child health leader, I am bridging the gap between pregnant women and places in our communities that offer hope and healing for moms, babies, and families. I will be joining the IU School of Medicine Department of Pediatrics and working alongside a chaplain, serving as a liaison that establishes relationships between grassroots efforts, pregnant women, and churches. Together we will bring about the root causes and consequences of infant mortality to women in faith-based communities, and then build skills to reduce our infant mortality rates. We will offer spiritual care that is not judgmental for women during pregnancy and after they deliver, so that women can maintain a healthy state of mind and reduce their stresses and worries and begin the journey of motherhood with joy and peace. Thank you so much.
All right. Hi, how y'all doing? Okay, so this was just like when we went over this in rehearsal, and I'm like, really? I got me coming up after her, and I got to be all emotional and in my feelings? All right, but I know the screen says, well, it did say Victoria Thomas, but my name is Victoria Jackson. When I originally started Grassroots, I was single, but I'm not now, so. But I'm really excited and honored to be speaking at the Labor of Love event. 2019 has been an amazing year for me, and this is one of the best ways that I can think to end the year going into 2020. I do not take the opportunity lightly, as it is so important, especially during these times, to have leaders and advocates in our communities building and implementing foundations to support healthy pregnancies and infants. Quick temporary changes or Band-Aids over the current issues of infant mortality, domestic violence, and mental instability are not what our communities need. We need social changes, policy changes, and economic and environmental changes that are going to be long-lasting and effective. This is what is mandatory and imperative to the growth and change of our Indiana families. I am a mother of two beautiful little girls, ages 3 and 5. They are my inspiration for what I do. It is because of them that I was led to where I am today. When I look back on the last 5 years and reflect on everything that I have been through, I have to acknowledge that they went through those exact same experiences with me. I didn't always provide the best images for them to see. Oh,
You got it.
I was in a domestic violence relationship with their father. Oh, Jesus. It was extremely toxic. I reached out to help several times, with his family, asking for an hour to myself or just to have some alone time, only to be told that I have children now and no longer am afforded alone time. I had pregnancy counselors come to my house and do their usual routines and paperwork and to check on me. Because I worked in a daycare at the time and knew all the right answers to their questions, I put on my mask and politely told them what they wanted to hear and sent them on their way. All the while suffering with depression, a situationship with their father, and still going to work and helping to provide for my babies. I thank God for my experiences, however. Because of them, I know how important it is to create lasting relationships. I know how important it is to a mother, and even those that are soon to be mothers, to need someone to talk to. I know how important it is, and I know what it looks like when I ask a mother, is she okay? And she tells me everything is fine, but really, she feels like her life is hell. I understand what it means to not want to wake up in the morning and feel like everyone is against you, and it shows in your actions and how you treat others, because our reality is only an exact reflection of how we feel on the inside. As a Grassroots maternal and child health leader, I am taking action to make changes in our community to improve birth outcomes by telling my story and being the voice for those that have lost or don't know they have a voice. I am grateful for the opportunities of going to the State House and sitting in on meetings with legislators about pregnancy accommodations in the workplace. Speaking about infant mortality rates at the Indiana State Department of Health, being involved with the Fetal and Infant Mortality Review Board Community Action Team, attending the amazing documentary of chocolate milk presented by the Indiana Breastfeeding Coalition and the Indiana Black Breastfeeding Coalition, and speaking on the panel, being surrounded by women that have been passionate and dedicated to improving infant mortality rates, especially among Black women. Through these many opportunities, I am now a breastfeeding peer counselor with the WIC through the Marion County Health Department. I'm able to sit with mothers, build relationships with them, teach, and help them reduce infant mortality rates simply by breastfeeding. They say it takes a village to raise a child, and this is most definitely true. But it also takes that same village to stand up together, unite, and create change for the better future and development of a child in the many generations to come. Thank you.
Good afternoon, everybody. Keep moving. Hello. Sorry. All right. I'm sorry, my speech just left. Sorry. Okay. It went somewhere. I don't know where it went. Anyways, hello, my name is Destiny Faceson, and I am a Grassroots maternal and child health leader, passionate about creating policies that will improve birth outcomes and improve quality of life for low-income moms and babies. I don't know where my speech just went. It's gone. I am a student at IUPUI in the School of Philanthropy, and because of my connections in this grassroots leadership program, I am now fortunate enough to work at the IU Public Policy Institute. Thank you. I would like to thank Labor of Love and you, the participants, for giving us, the Grassroots Maternal and Child Health leaders, an opportunity to be heard in this forum. As a Grassroots MCH leader, I am working for my neighborhood because it has suffered infant loss for a long time. Why is it important for me to focus on my neighborhood? Because it is where I live. We share lived experiences. We are all within it. I can connect. Our city has a problem. There are not enough bridge builders between neighborhoods with infant mortality and the health and social services providers. I see my role as a bridge builder for moms and babies. I am a community translator. Imagine finding out you're pregnant and knowing nothing about how to care for a baby on your own. The only thing the doctor told me when I found out was, "Congratulations, you're pregnant. Here's a bottle of prenatal pills to make sure you and baby are getting the proper amount of vitamins and nutrients every day. When you leave out, go to the front desk and they can get you started on your first prenatal appointment." I was already 3 weeks in, and all I could think about was, how am I going to take care of a baby when I work and go to school full time? Already living with people who have kids, and not so sure if the father was going to stick around to help me. I instantly became depressed and stressed. For months, I continued life as I always had, going to work and school full time, and continued to live with family members who already had kids. But now I was a lot more tired, hungry, always needing to use the bathroom, emotional, and still depressed and stressed about how I was going to care for a baby. Day in and day out, I would wake up at 5 o'clock in the morning, get ready for work and school, walk 1.2 miles to the bus stop to catch the 6 o'clock bus, jump off and onto the second bus going to the international airport, where I had to be at work by 8. In the afternoon, I take the bus back downtown, jump off onto another bus, and go to school from 6 to about 9:30. I had back-to-back classes 4 days a week. After class, I would get back on the bus, then walk that 1.2 miles back home. I hated it. Every time I was on the bus, I fell asleep. Every morning and night, I walked to and from the bus stop in the dark, walking through neighborhoods that didn't always have working streetlights. I would always look over my shoulders to make sure no one was trying to rob me for my backpack or my purse. My feet would be killing me daily because my feet would dangle on the bus because I was short and because I had to walk everywhere. When having to go to appointments, I had to miss work or pick up an extra shift or switch a shift with someone because my appointments were always during the week. Back then, weekend appointments were not available. So when I began to have appointments every 2 weeks, I lost my job. When I finally had my son, I was still staying with family members and their kids, but now I was house to house. I remember not having enough room to set up my pack and play and stuffing a crate with pillows and blankets so he wasn't sleeping with me. I would swaddle him really good, then put him right beside the couch that I was sleeping on, lay my hand on top of his body to make sure that he didn't wake up or if he happened to move around. I didn't want my baby to suffocate and die. It didn't take long when I realized I didn't want to raise my son in that type of environment. So I checked me and my then 1-month-old into the Salvation Army where we lived until I found an apartment. Because of these experiences, I know how important it is to take action to make changes for moms, babies, and families. As a grassroots MCH leader, here are some of the actions I have taken to improve the quality of life for low-income moms and their babies. I gave feedback on legislation for pregnancy accommodations in the workplace. I also gave feedback to Representative Carson regarding House Bill H.R. 4215, which is being put forth to improve funding for education and advocacy to reduce infant and maternal mortality. Currently, I am writing a policy to eliminate sales tax on diapers and feminine hygiene products. Do you know that we have women who cannot afford diapers, wipes, or feminine hygiene products living right down the street? Shouldn't this be a human right? We need to eliminate this barrier for women and children. Other states have already did this, and we need to make this step too. Yes. The labor of love has been going on for years. What are you going to do to save a baby in your community before the next labor of love? What networking are you doing to make a change for your community, even now in this room, during this summit? Who have you connected with? What goals are you setting to accomplish before the next labor of love? All of us as grassroots leaders want to know this and help you meet your goals for your community. We are your community translators. Thank you.
Awesome, great job. Thank you so much, ladies, for, first of all, the bravery in sharing your stories. Your insight and your call to action, but mostly, thank you for your wisdom. Do you know that in the ancient Western civilizations, wisdom was always personified as a woman? In the book of Proverbs, it says, "Does not wisdom call? Does not understanding raise her voice? On the heights by the path, and in the path she takes her stand." I think you can all understand, after hearing the ladies' talks, why the ancients always personified wisdom as a woman. Now, my friends, it's our collective responsibility to listen and learn from wisdom as she takes her stand to save babies across Indiana. Thank you so much.